Good afternoon, everyone, and welcome to today's webinar hosted by the National Environmental Health Association. My name is Reem Tariq. I'm a Senior Project Coordinator at Neha, and I'll be facilitating today's webinar. Thank you so much for joining us. The title of today's webinar is Environmental Health and Government Affairs in 2021. This webinar will focus on the environmental health priorities at CDC, FDA, and EPA under the Biden administration. This webinar is the second installment of NEHA's Government Affairs webinar series, and NEHA has partnered with the Business Industry Affiliate to bring you this particular installment for this webinar. The Business Industry Affiliate, or the BIA, is NEHA's newest affiliate, which primarily represents private industry. The BIA provides NEHA with a forum to obtain industry input using a communication network that reaches across all sectors. The BIA partners with NEHA and is committed to bringing current topics and experts to members, guests, through its meetings, webinars, and conference sessions. BIA's chief goal is to enhance environmental health through collaboration amongst business, academia, and regulatory sectors. BIA membership is open to all persons, businesses, and organizations who work in or support environmental health profession. And to learn more about the BIA, you can visit their website at www.nehabia.org. And with that, before we get into the further details of the webinar, I would like to have NEHA's membership manager, Jonna Ashley, to share a few words on NEHA and NEHA membership for those who are not as familiar with their association. Jonna?
Thank you, Reem, and thank you all of you out there for participating today. I believe there are over 300 people in attendance, which speaks to your commitment to showing up for our profession, even when I know that so many of you are stretched to the limit these times. NEHA is the only national association dedicated entirely to the profession of environmental health. We are the folks that understand better than anyone the critical work that you do every day. Our mission is to build, sustain, and empower you, the environmental health workforce. We do this primarily through education, advocacy, and our credentials, which represent a standard of excellence in the profession. NEHA enables you to congregate and collaborate with one another to identify challenges and develop solutions to the problems facing our communities. The webinar that we're all about to enjoy is one of over 30 free webinars that NEHA offered in recent months. Over the past year, NEHA has presented relevant education to thousands of people through webinars, e-learning, and virtual conferences. In 2020, every one of those offerings was completely free for our members. The work that Doug is doing that you will hear about today is done on behalf of our members who support the work of this organization. I'm not exaggerating when I say that we could not do what we do without those of you who choose to support NEHA through membership. If you're not a member, or if you think that your membership may have lapsed, I encourage you to join. We have membership categories with dues as low as $25 for the entire year. If you have questions about membership following the program today, I'm here to help. I would like nothing more than to hear from someone who participated in this webinar saying that they want to learn more about membership. My email is jashley@neha.org. And with that, thank you again for showing up here today, and I hand the mic back to Reem and Doug.
Thanks, Jonna. So for today's webinar, we'll go over the ambitious agendas of the CDC, FDA, and EPA based on the issues that the Biden administration wants to accomplish. So things from COVID-19 to climate change, each agency will take on many issues they seek to tackle. Our aim in this webinar is to address questions like what will be the main priorities for each agency on environmental health? What policies and regulations can we expect? And the presenter for today's webinar is none other than our very own Doug Farquhar. Doug currently serves as the Director of Government Affairs at NEHA, which is the largest and most influential environmental health professional association in the US dedicated solely to the practice of environmental public health. But before we get into that, I just wanted to cover some items for Housekeeping. Please note that this webinar is being recorded. The webinar recording will be uploaded onto neha.org by Monday, January 18th. You may use the chat box to notify panelists about any audio or video concerns. But as far as questions go, please hold those towards the end of the webinar, and do use the Q&A box to put in your questions, and we'll try to take them as Doug is comfortable. With regards to the last item, please complete the evaluation survey that'll pop up as soon as you close out this webinar. Your feedback is really important to us.
Well, I'm Doug Farquhar. I direct government affairs at the National Environmental Health Association, and I'd like to talk about government affairs and what we'll be seeing in 2021. First of all, why do we need government affairs? Well, one of the best pieces of wisdom I was ever given came from Roger Johnson, who formerly directed the North Dakota Ag Office. And he often told me, if you're not at the table, you're on the menu. And that meaning that if you do not engage in government affairs, policymakers will not understand what you do, what projects you work on, and why your issues are important. Next slide, Reem. How we come up with scientific research. Legislative processes and procedures are complex. Every state has a different approach. Congress has a different approach. Every agency within the federal government has a different approach. When you deal with promulgating a regulation from FDA, it takes a different process than EPA's regulations, even though technically they're supposed to be done the same. It's very important to understand how each agency, how each state, how each policymaking community adopts process, how they get information, how they process information. Last year, we saw almost 175,000 bills introduced across the 50 states, the District of Columbia, and Puerto Rico. Very few of these become law, only about 10% on average. If you include the Congress with that, even less become law. Very few bills become law in Congress. And I see we have a question. We may want to try to hold our questions to the end and then try to go over them at that time rather than going throughout. I'm going to go through probably about 15 slides, and then we'll turn it over to the questions. Regarding politics, the country is evenly divided. We got about 30%, 33% registered as Democrats, 29% registered as consider themselves Republican, are controlled by Republican governments. 47 are controlled by Democratic governments. Redistrict, therefore, when you see who are Republicans, this is all reflective of redistricting and the Electoral College. Looking at the 117th Congress, the next Congress that will be up from 2021 through 2023, it is controlled by Democrats, unlike the states. It'll be controlled by Democrats. There are 222 Democrats in the House, 211 in Republicans are in the House, and we have 2 vacancies still waiting to be determined. And as many of you know, the Senate will be controlled by Democrats. It's technically a 50-50 split, with Vice President Harris going to become the deciding vote in the Senate. The reason that this is important, this election in Georgia was extremely important because it's going to give the Biden administration more ability to get their nominations approved. They're going to have a chance to have their policies heard, and it's going to give them a little bit more opportunity to get their bills passed. But with a 50-50 control in the Senate and a tight control in the House, This isn't going to be able to be a progressive legislature, congressional session. It is going to be something where there's going to have to be compromise, that Democrats are going to have to hear what the Republicans have to say and encourage as many Republican votes as they can to ensure anything gets passed. A couple things that I think are going to be important coming around is the economy. One of the interesting things that they have noted is that the public sector has lost 1.5 million jobs since COVID began in March. But interestingly enough, between October 2019 through October 2020, the Labor Department identified that sewer and wastewater sector has grown by 1.2%. Water facilities that job sector has grown by 8.7%. And that's versus other job sectors such as transportation or entertainment or hospitality, each which have lost over 50% of their jobs since last March. So environmental health is actually growing, even though we are seeing job losses in the public sector, severe job losses in the public sector. And this is very much reflective of the loss of revenue. Estimates of 135 billion have been lost in revenue in state and local governments. That is not something that we can expect to be made up by the federal government. Regarding the federal government, we can expect another federal stimulus is possible. These checks are probably going to be $2,000 a piece after the great challenge that was happened in December of having $600 stimulus checks versus $2,000. Another big change is that there's going to be a likelihood that state and local governments will receive about $100 billion in aid, which they will very much gladly take. The CARES Act, a couple things I want to highlight with that is that of the $5 trillion quarter we just had, $3 trillion of it came from the federal government. That means the reason that the economy kept moving forward and we didn't fall into at least a recession, if not a depression, is because of the federal stimulus. Governments received direct, $350 billion was directly received by governments, hospitals and transports and airports to stay in business. So the stimulus cannot be underestimated as the reason for keeping the economy going. What are we going to see with funding in the next fiscal year? Now, this is funding numbers that were determined by the current Congress and signed by the Trump administration, even though it's funding for the next fiscal year. CDC saw $784 billion in funding. That is an increase of 125 million above the fiscal year 2020 numbers. 56 million is being offered for public health workforce and career development. A couple of the activities that they are going to really emphasize on is the NHANES, the National Health and Nutrition Examination Survey. They want to Congress wants to invest in CDC data. They want CDC to find out what are the health metrics out there. So they are supporting not only NHANES, but the public health data modernization efforts by the CDC. So we should see a lot more activity and a lot more funding going out to labs and to operations that support health metrics. Other parts of CDC, the National Center for Emergency and Zoonotics and Infectious Disease, they received $648 million. The National Center for Environmental Health, they are at $222 million. Couple of important things there is the water program received $8.6 million of an increase. Climate and Health, the climate program received $10 million. Tracking in the National Center for Environmental Health, they received $34 million. And the lead program was increased up to $34 million. So they did pretty well this go around. Another issue that they are that National Center for Environmental Health will be addressing is on PFAS, and Congress gave them $1 million to do training. For FDA, the Congress gave them $3.2 billion in budgetary funding, and with the fees that they collect, it's going to be almost $6 billion for fiscal year 2021. They received, it's an increase of $42.25 million, $15 million in food safety. And that includes $1 million for the expanded direction and removal of contaminated food from the marketplace. They also got $5 million to regulate cannabis and cannabis derivatives. That includes not only dietary supplements, but also food and feed alternatives. So FDA has got to the point where they are going to be addressing CBD now that it is such a common activity out there in the nation. Finally, I'll just, as I mentioned, $1 million is being funded for the National Antimicrobial Resistant Monitoring Program. So the Congress wants to get their eyes or get a handle around the fact that so many antibiotics are being pumped into the food system that it might be detrimental to the health of the nation. EPA, their funding has increased 9.2, it's up to 9.24 billion. Not only it's an increase of 180 million over 2020, it's a $2 billion increase over what the Trump administration recommended. So essentially Congress ignored any requests from the Trump administration regarding their funding amounts. One of the couple of things that they are investing in is $3.5 billion for the core science and environmental program work. So Congress has a strong investment that way. The other strong investment is the $4.3 billion for state and tribal assistance grants. So those are moving forward as well. Of the $3.5 billion, $566 million is for environmental compliance and monitoring enforcement, which is a $14 million increase over 2020. And $53 million in funding at EPA is for scientific and regulatory work to address PFAS in water standards and within cleanup. So the EPA is going to have quite a bit of funding available to address PFAS. There's also going to be $2.77 billion for the drinking water revolving funds, which is above the 2020 enacted levels. There's also going to be $40 million for sewer overflow grants, $90 million for brownfields, and $90 million for diesel emission reduction grants. So all this is well above the president's requests. Finally, public health and response, they've received $842 million, majority of it going for public health emergency preparedness cooperative agreements, and $139 million for CDC preparedness. What are the states looking like? Well, they're in much different situation. Even though a few states such as the Alabama General Fund, Iowa, New York, and especially Utah have received quite a bit of extra funding during this go around. Most of the states are between 5 to 10 to 20% decrease in funding available. The states that are suffering the most are the ones that rely on oil and gas revenue. Wyoming, Oklahoma, West Virginia, Alaska, Louisiana, North Dakota, and Texas all saw a decline. Wyoming being the most severe decline. Their reserve fund dropped by 74% in 2020. Each of these states that I just listed saw a 10% or greater decrease in their revenues. So these states that have been relying on oil and gas are really in a tough state. Other states that saw a major decline did include states such as Connecticut, Massachusetts, Nevada saw a severe decline, but primarily overall the states that suffered the worst were the oil and gas states. Stimulus funds from the federal government helped tremendously to these states to keep them afloat. It would have been much worse without their stimulus needs, but the majority of these states are going to have to rely on rainy day funds to patch up their budget shortfalls. It's going to be a tough year for for majority of state employees and state programs. They do anticipate that by the third quarter of the fiscal year that most revenue will be, the economy will be back in action, and most states will be receiving a good year in revenue, but that won't occur until the third quarter at the earliest. Many states don't think their economies are going to recover until the fourth quarter. What does that mean for environmental health? Well, there are two key issues that the administration are going to be focusing on that deal with environmental health. And first of all is COVID. And as you know from most of these comments here, we've seen 22.3 million cases as of January 12th, 25 million vaccinations, over 373,000 deaths. But what they're thinking is we're finally turning the corner. We're finally going to be seeing full recovery once the CDC and once these vaccines get distributed. Not only do we have the four vaccines that are currently known to be available, others are emerging all the time, which means better products. We can assume better vaccines will be coming available. As distribution becomes more likely, it's going to allow for people to start engaging in economic activity, returning to restaurants, traveling again. So these are things that are going to be turning, and it's going to make things look better in 2021. But for the most part, people are considering 2021 is going to be the year to contain COVID. It's the year to really put COVID to bed. It's going to be 2022 that's going to be the year that we're going to see the economic recovery from COVID. There are a couple things out there that to remember. COVID has caused a great deal of economic problems to the economy. Texas has identified that they're going to have a $1 billion deficit that they're going to have to overcome. California, oddly enough, they thought they were going to have a deficit, but since COVID has been so economically beneficial to wealthy people, California is going to see a surplus in their budget this year. Texas, because they don't have an income tax there, they will not see the benefits of all this extra money coming to the wealthy. So they're going to be suffering this year, unlike California. Climate change. When the Biden administration talks about their top priorities, one of them is always climate change. Their number one priority to deal with is COVID. The economy and getting people back to work is another primary issue. But number three is climate change. So it's very important for us to pay attention to what they're doing. They're going to take an entirely different approach than what we saw with the last administration. Probably one of the first things that the Biden administration will do is rejoin the Paris Climate Accords. Other thing that they're likely to do is repeal the Trump executive orders. Most of these executive orders were done with, well, all of them were done without having congressional input or having Congress adopt them. Therefore, they're going to be very easy for Biden administration to reject and repeal. It's also the tougher effort will be rejecting or repealing EPA policies that are adverse to climate change. Many of these challenges can be done procedurally. That means that the that the Trump administration didn't follow the Procedures Act precisely to get them adopted, so therefore they can be challenged in court and just simply thrown out on essentially technicalities. If there are substantive policies that Trump administration did adopt, those are going to take more effort for the Biden administration to repeal. They're not going to repeal everything, but there's probably a majority of these policies that the Trump administration did under EPA that are adverse to climate change will be pulled back. Final thing I want to bring forth is the Green New Deal. This is something that, of course, has been batted around in Congress for the past few years, but I think there's going to be a strong effort to try to get it enacted in the next couple of years. The reason I'm saying that is because come 2022, historically, that is the year that Congress flips. And so there's a real good likelihood that either the Senate or the House or both will flip over to Republican control. At that point, trying to get a Green New Deal passed is going to be very difficult. And it's going to be very important for the Biden administration to show that they were able to adopt something that the progressives have wanted in their party. So this is probably their easiest lift for the progressive wings of the party that they will probably be able to get adopted, but it's most likely going to be primarily argued within the House, and that the Senate is probably going to adopt whatever they have by reconciliation, meaning that the Senate will not amend or change anything that the House comes up with. Environmental health concerns in the federal government and at the state government. This is something I've talked about over and over again. The federal government is going to be looking at climate change. They're going to be looking at social determinants of health, and I could see that bill being enacted, which is going to provide extra efforts at the CDC to identify social determinants and start providing some metrics for identifying what is going to be the biggest problems out there, environmental problems primarily, that affect health. Chemical safety at EPA, that suffered some changes, some challenges under the Trump administration. I think we're going to be seeing some changes there with the new administration that's going to really start strengthening some of the authorities that Congress gave them under the Lautenberg Act back in 2016. And so we'll see some activity there. Board of Scientific Counselors, the reason I brought that in is the Trump administration disbanded that group for the NCEH back in 2017. I see the Biden administration reconvening that group and other scientific advisory groups among the federal agencies. Finally, there's appropriations. As long as the Democrats control the House, we will see generous operations with appropriations. When the Republicans can take over, we see the opposite. There's a lot more, much less generous amounts of funding available within the federal government. So I think that's going to be one of the key things. And the key things with appropriations is Rosa DeLauro will be the chair of appropriations in the House. She has been the foremost champion of food safety in Congress. Therefore, we can assume that FDA food safety efforts and food safety efforts at USDA and at CDC will be amplified. But what does that mean for state and local activities? Well, you still have issues such as adoption of the food code, nutrition labeling, retail food inspections and grading, the state drinking water revolving funds, chemical safety. States are still involved with that area, water, wastewater, stormwater, septic systems, domestic well water, retail food safety, sanitation, lead hazards, COVID-19. All these issues still have to be addressed, whether you're getting support from the federal government or not. It does not matter if the federal government is acting on these issues. These are problems that have to be addressed. Now, looking forward to the Biden administration, at this point, we do know that there are 4,000 politically appointed positions within the federal government. The Trump administration never filled all their appointed positions. They did not feel that was important. but the Biden administration are very likely to fill all these positions. 1,250 requires Senate confirmation, and of these, really 756 are key. Now, so far, the Biden administration has nominated 32 of the key positions, including every cabinet post. But unlike the Trump administration or the Obama administration, where the Senate had already confirmed some of these cabinet positions before they took office on January 20th on Inauguration Day. In this situation, none of the cabinet positions are scheduled for Senate confirmation. There's some discussion that they will start doing confirmations on the 19th, the day before the inauguration, but that's going to put them well behind where they were 4 years ago. Most of the White House posts have been received their nominations, but once the Democrats take over on January 20th, it's not exactly determined when the Georgia Senate seats will be sworn in, but at that point, it seems like it's going to be much more likely that the nomination situation will move forward. Administration, environmental health within the administration, as we know, climate change is going to be very important, and that is reflective of the fact that they appointed John Kerry and Gina McCarthy as White House spokespersons for climate change. But we already know the nomination for the EPA administrator. It's Michael Regan out of North Carolina. He has run their Department of Environmental Quality there, and has been a former EPA official. The Council on Environmental Quality chair is going to be Brenda Mallory, a holdover from not holdover, but a person who was involved with the Obama administration. Jennifer Granholm is going to be with the Department of Energy. That's very important because she's always been an advocate of alternative forms of energy besides fossil fuels. Department of Interior, Representative Deb Haaland. HUD Secretary is going to be Marcia Fudge out of Cleveland. CDC Director, Rochelle Walensky. She is not someone who is familiar with environmental health, so we're going to have to do some work to teach her. But on the other hand, the Attorney General, Merrick Garland, is very familiar with the environment. He has heard cases and been involved in cases dealing with the Clean Air Act. So that will be a benefit for the environmental health community, having him involved. And the HHS Secretary, that as well, it's going to be good to have him involved because he will have some background in environment and will have a good likelihood of being familiar with some of these topics, and so be able to advance the environment within the Department of Justice. At this point, it gives me an opportunity to open it up to some questions. I'm going to try to see which questions we have and see if I can answer anything quickly. How do we enforce CDC guidelines in Delaware? Let me put that forward to my next slide. Can you speak about what we know about the proposed EPA lead? Are you talking about the lead and copper rule? If that is such that has been moved forward, I am not seeing, if it is not strong enough, or let me put it this way, if it does not meet the congressional standards of Title 10, then it's going to go back and we'll probably see a new proposal come forward. We have a lot of activity that's probably going to happen regarding lead, especially lead service lines, lead in water, that will come up in the next administration. Unlike CDC, EPA has several of the key assistant administrators that are appointed by the president. And with that, that's going to mean that it's going to provide a lot more opportunity for the Biden administration to put their fingerprints on the on the rules that will be coming out and the activities and the policies that EPA will be doing. So there will probably be, and this is just a speculation, but probably a lot of effort regarding activities that are important to the Biden administration: climate change, PFAS, chemical safety, health data. Another issue that's probably going to come up and is going to be predominant within the new EPA is going to be environmental justice. The Trump administration was limited on what they did on environmental justice. The new administration has shown indications that they're going to be just the opposite, that they're going to be quite active regarding environmental justice, that they'll reconvene the environmental justice office, and that they'll probably have a more proactive effort. What that will look like is going to be very uncertain, meaning are they going to have simply policies where they encourage the recognition of environmental justice issues, or are they going to have regulations where there'll be some enforcement actions if certain polluters are operating in areas with vulnerable communities around them? So that's going to be very, a strong change that we're going to be seeing within the EPA. But that we don't know at this point, because I haven't heard anything about EPA sub-appointees. The next question I'll answer before moving on is, what do we do about complaints of employers who let customers who are positive with COVID but are not wearing masks? How does the public health community and the environmental health community work with non-compliant people out there? The reason I find this really interesting is because this is something that Neha has actually looked at, something I've been looking at. What are your legal authority to move in? What are their authorities not to wear a mask? There is not a national law out there that says everybody has to wear a mask. And even the state laws, these are all based on emergency operations within the state of Delaware. The governor only has emergency operations authority for a month. Then it has to be reauthorized by the legislature. Other states like Michigan, the governor has quite a bit of emergency authority, but that emergency authority was the reason that they had the problem with the Flint situation, because the governor had so much authority to preempt any activity that was going on by the Department of Health and by the Flint Water Authority, that now the governor is liable for poisoning of people, of the children in Flint. So I'm going to move on with a few more slides that I really want to get to, and then get back into your questions, but I just wanted to take a pause here to address them. The next slide, let me see if I can move it forward. It is giving me fussing here. There we go. This is what I want to get back to, and that the point being of legislative policy. How do we get things through a legislature? Congress, your local city council, your state legislature. These are things I've learned. First of all, there's going to be rejection. There's going to be denial. They're going to say, this is not a problem. I grew up in Kellogg. There's lead tailings everywhere. I did fine. Anger. They're going to want to reject you. The EPA is totally out of control. The CDC isn't much better. Then we're going to see bargaining. What can we do to get away with adopting this policy? One of the questions I got from a Michigan legislative committee once was, can we take the EPA money and simply not do the program? Next one, of course, is depression. I fear for the future of our country. That was a quote by Representative Carl Gatto when he heard that we adopted the Affordable Care Act. And finally, acceptance. I'd rather have Mississippi run this program than the EPA. The reason I put this in this manner is because if you have a policy, if it's a good policy, it's a solid policy, and you bring it up to them enough times, they will come around to your way of thinking. If you only come in, if you introduce it once, if you don't have you're not willing to come back time and time again, or if you don't have a broad stakeholder community, if it's only the state legislature or the state health department that's bringing up an issue, then it makes it very easy for the state legislature or the county city council or the county commissioners to simply say it's not important. It's not important to the business community. It's not important to the public health community. It's not important to the grassroots community. Then it's not important to me. So you have to have a very broad approach and be very dogged in moving forward legislative policy. Party control of state legislatures. I want to bring this up and then add an extremely important caveat. First of all, majority of state legislators are Republicans. Ever since the 2010 election, Republicans have dominated the state legislatures, both in the House and the Senate. When you try to compare the chambers, and the reason we have a listing of 98 chambers out there, that means in 49 states, there is a House and there is a Senate. In Nebraska, they only have a Senate. So it's only 98, actually 99 chambers total. When you look at them, but since Nebraska is nonpartisan, it doesn't count in this list. But when you look at those 98 chambers, 62% of them are controlled by Republicans, and only 38% are controlled by Democrats. And even under that situation, you have a majority of states that are completely controlled, including the governor, in 22 states by Republican, only 14 by the Democrats. The other 13 are divided. You may think that that's going to say that the Democrats or that progressive policies will have no say. My answer back to that is that's absolutely not true. When you have a state legislature or a county that is completely controlled by one party, all the problems of that county fall on that one party. So the fact that you have PFAS doesn't mean it's a Democrat or Republican issue, it's your issue, and you have to deal with it. The fact that you have that you are dealing with an outdated food code, it's not a Democratic issue, it's not a Republican issue, it's your issue. One of the most telling points this year is that the Louisiana legislature, which is predominantly Republican and always been conservative, adopted carbon sequestration policies this year. So even in the state of Louisiana, with a strong fossil fuels economy, they adopted some climate change and global warming issues out there. And it's also important to remember that most states are really becoming one-party states. Wyoming, their legislature is down to only 9 Democrats. In Hawaii, the state Senate only has 1 Republican. So when you're dealing with working with decision makers, you're more than likely going to be dealing with single party issues. To take a look at the state legislatures, lot of variety out there. I want to go over this real quick, but I just want to kind of get back to the point. When you're dealing with the state legislature or your city council or Congress, you got to remember that each one is very different. New Hampshire has over 400 legislative House seats. That's 1 per 3,000 voters. Very likely, if you want to get something done in New Hampshire, you probably can sit down with your House member over a cup of coffee. However, California and Texas, their Senate districts are larger than congressional seats, meaning meeting the senators from the states of California or Texas is going to be more difficult than trying to meet with your congressperson. Sessions. New Mexico has a 3-month session, then it has a 1-month session. So if you're caught in the 1-month session, it's going to be very difficult to get issues addressed. Number 2, year-round sessions. California, Minnesota, Wisconsin, Illinois, Michigan, Ohio, Pennsylvania, New York, New Jersey, and Massachusetts. They have sessions that are year-round which gives you an opportunity to talk to the legislators year-round, whereas Montana, Nevada, North Dakota, and Texas, they only have sessions once every other year. So if you want to get a bill passed, you have to do it during the even number year, or the odd number years is what it should say, during the odd number years of 2021 or 2023. Rules of procedure, unlimited bill introduction. Very easy to get a bill introduced in New York, very difficult to get it adopted. With limited bill introduction like in Colorado, they only have 6, so it's very difficult to get something introduced, but you got a good chance of getting something enacted. With bill limitations, certain states are limit bills or limit activity to only budgets in certain years. So that's something you got to be aware of. If you want something passed in Louisiana, you got to go forward in the even number years. Partisan makeup is, as you can see, it's predominantly Republicans. This is primarily due to the fact of redistricting. There are so many Republican-controlled legislatures out there, meaning there's so many Republican-controlled redistricting committees, and that provides an incredible advantage to the Republicans. The fact that the Democrats took over Congress in 2018 is really surprising in light of the fact that the Republicans have such strong control over the redistricting process. With that, I am going to hold off on moving forward on any more of my questions and slides and see if there's any questions. Reem, can you help me see the questions?
Sure. All right, so let's take a look at some questions that have come in. Mitch asked a question, could you speak to anything related to environmental justice activities being a priority within this administration?
It's, as I was mentioning earlier, it's going to be an extreme priority. It's going to be something that is, like I said, I think they're probably going to reconvene on EPA's Office of Environmental Justice to make it stronger and make it more relevant. Another really important thing is the Council of Environmental Quality is being run by an African-American woman. She's probably going to take a new approach, and we could see some activity, some language coming out of that office, which may make environmental justice issues a consideration when doing an environmental impact assessment. So that is something that could be a possibility, which would really greatly strengthen environmental justice within the new administration.
Great. Eric asked a question, environmental factors seem to be folded into social determinants of health. Is there a way for Neha to push for a distinct focus on the environmental impacts on health?
You know, that's a very important question. When I was reviewing the social determinants of health bills that were introduced in the 116th Congress, that was one of the things that really highlighted for me was the amount that environment was included into it. So it's a very important element. We don't know what the new bills are going to be looking like. I'm under the assumption that social determinants of health will be reintroduced in the 117th Congress, and unlike the last Congress, I think they have a stronger chance of being enacted. I think it's going to be very important for NEHA to have a response to that and a policy, and I think it's going to be something that we are going to have to be probably pretty proactive with our Hill Day. So when we do have Hill Day later on in the spring, being able to address some of these aspects of social determinants of health are going to be very key.
Excellent. James asked, any talk of using the Congressional Review Act to undo some recent EPA regulations?
The short answer is yes. There's a lot of talk about that. As I was mentioning, the procedures that were used for many of the EPA regulations and for many of the other things were somewhat short-circuited. They didn't use the proper comment period. They added issues where they weren't supposed to. They were basically sloppy. They did not do it properly, which makes it much, much easier for a court to say that they're, it's inadequate and has to be either repealed or redone. Most likely what the court's going to be saying is that this policy needs to be redone. Well, there's going to be no interest at the Biden administration's EPA to adopt, go through the procedures again for Trump administration policy. What most likely will happen is they'll either languish, go dormant, or simply be reintroduced that are going to be more pro climate change, more pro issues that the Biden administration ran on.
Thank you. Cynthia asked, what can we do at the local, county, or state level as an environmental health specialist to promote positive changes in our field of expertise?
One of the things I have often asked people is, if you are going to talk about environmental health, who is it most likely that you're going to be able to sit down and have a cup of coffee with? Your US Senator, your state senator, or your county commissioner? The lower you go, the more likely you can sit down and chat with them. One of my favorite stories is the reason that Georgia was one of the first states in the nation to adopt lead certification and EPA's lead policy is because someone from the CDC had a member of the legislature at their church, and they started talking about lead hazards over Bible study one day. These are all legitimate ways. When you start talking about other issues, and I mean energy, agriculture, education, these are all groups that directly engage their policymakers, that sit down with them, that provide information. They don't lobby them, they provide information. They let them know, why are you doing things this way? It's really up to the decision maker to decide what they're going to do. But they are not going to be able to respond if they don't have any information. One of the topics I often talk about is working with John Pruse, who's a state senator from Michigan. He wanted to adopt a cottage food bill. The reason he introduced the bill was because the Department of Health would never call him back. Whenever he would say, why do you have all these regulations in place? Why are they important? Why should we have them put into place? He never got a call back. So he introduced a cottage food bill, which basically exempted many farmers markets from any food safety oversight. So it's a group that we have to be involved with.
Great. Thank you so much, Doug. And I noticed that we're almost out of time, so we'll wrap things up. I just want to thank you, Doug, for sharing the fantastic overview of what the future holds under the Biden administration with regards to public health agencies and their agendas. Thank you to all the attendees for joining us and for participating. Thank you for your questions. Please note that Doug's contact information is listed on the chat box. I will put it in shortly. And just a quick reminder on the post-webinar survey that will pop up as soon as you close this Zoom session. So please do take that survey. Your feedback is very important to us. And with that, I will wrap up the session. I hope you all have a wonderful afternoon. Thank you and goodbye.
Thank you very much.